All right, so we're going to talk about the knee today. The knee is a hinge joint, which means that just like a door hinge, it's only designed to move this way. When you bend the knee this way, it's called flexion. When you extend the leg this way, it's called extension. Extension of the knee, flexion of the knee. So those are the words we're going to use. Now, when we're dealing with a joint, if you feel pain in the joint, that is a symptom of something that is going on either above the joint or below the joint. And so if you have a pain or something like that, or tightness or stiffness, and you know for a fact that there's no tears in the ligaments itself, then we can start to think about what are the muscles that are contributing to that sensation. The primary players, and I'm just going to give you the crash course on this based off of my several years of experience working with these types of things. The main players are going to be the lateral quad, which in lateral means kind of the outside. When we say lateral, we mean the outside of the center line. When we say medial, we mean towards the center line. So if I say lateral, that's what I'm saying here. Usually, when people don't have good shock absorption in their posterior chain and their abdomen, what happens is the body compensates by using the low back, the lateral quads, and kind of a backup system. So a lot of times the lateral quad gets overloaded and can tug on the knee this way, and then as a result the calf gets tight. And the lateral quad works also with the adductor, which is another word for the groin. So there's a long adductor and there's a short adductor closer to the center of your body. So the three players that we will be thinking about are the lateral quad, the long adductor, and then the calf, depending on kind of your situation. So those will be, think of those three as like almost pulleys. This is pulling this way, this is pulling this way, and then that's pulling down towards the foot. So all those tension members are pulling the joint and causing that discomfort. So what we want to do is assess where on our body there is a lot of muscular overload, maybe a little bit too much fatigue, where the joint is now starting to take a lot of the load and starting to talk to us. So when you have something like a therapy gun, this is the Booster Pro 2. I got it because it was cheaper than the Hypervolt, which is the the primary one. But if you have a therapy gun that has a couple of speeds and good intensity and stuff, that's really all you need. So don't be intimidated by this. As a matter of fact, less is more. Remember those old infomercials about knives? You want to let the knife do the work. We want to let the gun do the work. So don't jam it into your leg like that. Just kind of open up the pathway and really find along this line. It's probably going to be somewhere lower mid-thigh. I would say probably right around here. Normally that's where it is for a lot of people. Work the top and then kind of work the side. Don't try to go. The IT band is just a band that connects the knee to the hip. So don't go looking for that band. This is about the muscle itself. So as you can see, I'm just kind of taking a general assessment of the muscle. Ooh, I feel a little sticky spot right there. That's where I'm going to hang out for a little bit. And you should notice that if you move through that range of motion, you can almost do your own bootleg ART, which is active release. So you can kind of pin and let the muscle stretch, and you see how free my knee can be. And even in this motion, I can see, okay, my trigger point's kind of like right around here. Okay, so even just staying right here gives me additional blood flow and relief to the knee. So that's point number one. Then we want to go to the inside of the leg. And remember, think of the leg as a cylinder. It's going all the way around. So if your trigger point is here on the lateral quad, go 180 degrees to where the long adductor would go, and then trace that same line. And what you'll notice is, okay, for me, it's right around here where you'll start to feel things refer up towards the inner groin area and then out towards the knee. And the great thing is, the feedback for you will be if you feel a rush of circulation going through that joint and you feel like the foot and calf and hip are starting to work as a team. That's the outcome that we want, okay? So that's number 2. We're just going to kind of find the tightest point in your groin and just kind of hang out there. Do not do this type of deal. We're trying to find a particular trigger point, and it's dense tissue, so you're going to have to sit there for 30 seconds to a minute and let that really, really unload. A lot of people have a lot of dense tissue right here and outside by the hip because they sit a lot, and those muscles get jammed and, you know, overdeveloped. And so for me, I have a lot of density down in this area because I sprint. And so this is actually what's giving me relief through here, and I can even start to feel it in my toes a little bit, which is a great sign. Finally, you want to be very gentle with the inside of the calf because it's pretty sensitive, but work through this is called the gastroc, and then this is called the soleus near the Achilles. So that's, the inside's good, go about like a 3 out of 10 intensity on that, but then the outside is where you're really going to feel probably a little tenderness, but remember the point is we're trying to release this pulley from pulling too much tension on the knee. So we want to get part of the shin and the calf, kind of work both of those. And what you should notice is that your arches wake up in your feet. They might even cramp a little bit, and your toes will start to wake up a little bit as well. That's another good sign. And I think you'll notice, as you can see, I can move my toes a little bit. And I think you notice that once you stand up, all of a sudden the leg becomes one unit again. And as you can see, like, you'll be able to see definition and stuff like that, which means a lot of the muscles are firing up the way they should. Okay, so that's a quick crash course in how you can mitigate some of the discomfort in your knee if nothing's torn. But of course, this isn't medical advice. This is just suggestions based off of my experience as an athlete and as a trainer and consultant. If you have a true issue, you should definitely seek advice from a medical professional. All right, thank you.